and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Moses Lake Professional Pharmacy podcast studio, and we were doing this a second round because we had some audio issues to begin with. So we have Greg Bickel in the studio today. He's going to be talking about his independent medical practice in Yakima, Washington. So, Greg, welcome to our show.
Thanks, Shawn. Thanks, Janet.
Wonderful to have you again on our show. We were just reminiscing before we started that he was one of our first guests when we were in a radio studio. Brings back a lot of memories. But Greg, can you just share with our viewers a little bit about yourself and a little bit how your practice, because I feel it's a very unique and it's a good story that people need to know that's available.
Yeah, sure. Where do I start with this? I've always been interested in healthcare, actually. I originally went to Eastern Washington University to become a physical therapist, of all things, and studied that. I was in the pre-physical therapy program. And my senior year in college, I decided that I wasn't going to become a physical therapist. I decided that I was going to drop out of college and go into ministry, which I did. And I was a campus minister for about 5 years. I was in the pulpit for 4 years. Interestingly, when I called up all excited to tell my dad that I was going to drop out of physical therapy, become a physical therapist, and go into ministry, his quote to me was, "But Greg, you are going to be somebody." But we're okay. My dad and I are just fine.
Oh, good. Good to hear.
And we came around, and our relationship has been good, and it ended well for us. So anyway, what happened that I was in ministry. I got burned out. I wasn't being a good father. I wasn't being a good husband. And I decided that I needed to make a career change. And so I went from preaching to peddling drugs, but they were the pharmaceutical kind. And I did that for about 6 years. And while I was in clinics seeing what MDs, DOs, PAs, nurse practitioners were doing, it all of a sudden hit me. It's like, that's my niche. That's who I am. That's what I want to do because I love learning. I love science and I really enjoy people. And so it's like, what do I do now? Our boys at that time for Teresa and I were 16, 14, and 12 years of age. And it's like, if I go to medical school, that's 7 years. Right. And I'm going to miss out a ton on their growing up. And so I decided to go the PA route. And so was accepted into Western University of Health Sciences. I was at a branch campus in Chico, California for my year of learning called the didactic phase. Mm-hmm. And then I was back in Yakima to do my clinicals. And from there, I graduated. I went to work with a really good guy by the name of Dr. Kent Vi at Yakima Medical Clinic. From there, I went to work with Greg Swart at Best Practices. And while I was with Greg Swart, it all of a sudden hit me that I think I really want to open up my own clinic. I want to create something. I want to massage something. I want to make something out to what I really think good medicine can and should look like. And so I went to Teresa one day and I just said, "Teresa, I think I'm supposed to open up a medical clinic." And she looked at me and said, "But we can retire in a few years." Right. And I said, "Teresa, I think this is a God thing. I'm supposed to open up this clinic." And so we talked about it. We prayed about it. And several months later, she came to me and said, "Let's do it." And so Compassion Family Medicine was born.
How exciting. So, yeah. Shawn and I have had the pleasure of visiting Greg in his beautiful clinic. And one of the things that I think sets him apart is how you approach medicine with your patients. And I would like you to share, what's your thought process and how that all works for you? How does this come together? Because you're unique.
I might be a unicorn, maybe. I don't know. But so I really think that medicine, Janet, is best practice in relationship. And I think that is one of the really big things that's missing in medicine today. And especially if you're working within a system, we know that you have to see patients every 10 minutes and you have a number of quotas that you need to meet. And if you don't, then you get called in by mid-level management and that is discussed about why you aren't producing.
Right.
And so we don't do that at Compassion. How do you develop relationship in the context of a medical clinic? Well, here's my thought process. My responsibility is to come in and to sit down and actually sit down and look the patient in the eye and to carry on a conversation. And if I ask good questions and the patient gives me honest answers, then we're going to be a really, really, really good team. And that's really, I think, unique to us, is because I have a nurse practitioner by the name of Gavin Baker who does that exact same thing. He really totally gets it as to what medicine looks like. And we do have a why that we might explore a little bit later on. But I tell the patient that, and so we have this conversation, and I just tell them, hey, I'm on your team, and it's not that Greg knows everything and you know nothing. It's the exact opposite. We are at a level playing field, and I say, you've lived in your body for 45 years, and you know how it feels. You might not be able to put a diagnosis to it, but that's where I can come in and help. And so it's a level playing field. And actually, I tell the patient, you're the one that's really the more important one in the relationship, because it is your health. So when you leave the clinic, it's my hope that you feel like you've been listened to, that I've heard what you've had to say, that I've examined you in the systems that are appropriate for the visit, and then touched mentally and emotionally, and if and where appropriate, spiritually. I never push spiritual things on people, but if that happens to be a part of their life, then that's what we'll do. And then the last thing I'll tell a patient is this: if I'm not the right flavor of ice cream for you, it's okay. Let's just help you find the right flavor.
Right.
And all of a sudden people just go,
This is
and
nice.
we're off and running.
That's really cool. That's really cool. I love Greg telling this because I've actually heard it before, but the reason I love that is because I'm going to transition into the last few years in our country. I think we've had this problem of lost trust between our clients and patients and providers.
Yeah.
And so, we spoke a little bit about it earlier, but let's talk about this together. Why do you think that is?
Oh boy. A couple of things. I think that medical schools, PA schools, nurse practitioner schools no longer teach critical thinking. And I think that medicine is best practice. There's the science aspect of medicine, and then there's the art aspect of medicine.
Very true.
And I think that too many people just land on the science part, the protocols, the algorithms, and they forget about the patient being an individual.
Right.
And that maybe Victoza would work for this patient, but it's going to be Monjaro for this patient, for instance, as we think about type 2 diabetes or weight loss. And I think that really good clinicians combine the science and the art. And I think that the art is missing. I think the other thing that has occurred is because we're not teaching critical thinking anymore, that we just kind of trust everything that comes down from on high, whether it's the NIH or the CDC or the FDA. And I think that those, and public health as well. And I think that all of those bodies play a very, very important role in good medicine. But I think if you think about it, when you think about the standard of care,
right,
the standard of care can change.
Right.
And
overnight.
Overnight it can change. For instance, years ago, we used to think that pain was like the fifth vital sign. And
Right.
so then if a patient said that they were to come in and they had pain, we would just trust them and we would prescribe opiates for them because that was the standard of care.
Right.
Well, now what we've done is we've created an epidemic of people that are hooked on opiates. But that was the standard of care.
Correct.
And so I I think that it's important to think critically. Does this make sense? Does it fit my practice? Because each patient is a unique individual.
Very true. Very true. In fact, we interviewed a doctor not so long ago that was talking about fevers in children, and how you treat would be not just the number, but also by how the patient presents themselves, right? So we treat the patient, we don't treat the lab or the standard of care. We need to treat the patient.
Absolutely. Absolutely. In fact, one of the things that I'll tell moms and dads is that the fever is actually a good thing.
Mm-hmm.
Because it's the body's response to trying to kill the virus that's more than likely causing the issue. So 99, 100 degrees, that's not a bad thing.
Right.
If your child's a little uncomfortable and it gets up to 101, you wanted to do like a lukewarm bath or a sponge bath or Tylenol or ibuprofen, then that can be appropriate. But fevers aren't necessarily bad. Now, that's in the context of if you're at 103 or 104, that's a completely different picture.
Right.
But a mild low-grade fever isn't necessarily bad.
Right. So I think the other thing that I feel that's happened is we talked about the relationships, learning how to have good relationships with patients. And then we've talked about, a little bit about the public health. And I don't think most people realize that a lot of the journals that you and I might read, can you speak to that a little bit?
Yeah.
You realize the background of that.
I think the right word is captured.
There you go.
When you think about the FDA and drugs being released into society, when you think about the medical journals, the last I had heard, and it's probably higher, but I can't speak to the specifics, but at least 50% of their funding comes from Big Pharma. And so that sounds like that's being captured to me. For instance, when I go to a lecture for a drug company and the doctor is there, they have to present any sort of conflicts that they might have prior to speaking. Well, why don't journals have to do the same thing?
Right.
And actually, I think that the FDA should be completely devoid of any money coming from Big Pharma.
That's a very good point, because we talked earlier a little bit about the story of Vioxx being pulled off, but I think when there's so much money behind something, and maybe most people don't realize, but we talk about the revolving door that happens between Big Pharma and the FDA. And the problem of that happening is that then those conflicts can kind of stay in transition for too long of a period of time.
Yeah, it's basically nepotism is what it is.
Right.
And that's how it comes across to me.
And we also talked a little bit together about how by the time a drug comes to market, some of those studies and the numbers that are being presented might be a little washed.
Yeah, I think that's a good term. From my understanding, the FDA does not get the raw data from pharmaceutical companies when it comes to bringing a new compound to market, but it's more washed data. And that, I don't think that's a good idea. I think that it should be raw data, and then the pharmaceutical company can crunch the numbers, the FDA can crunch the numbers, and let's see where they have things in common and where they have disagreements, and then let's figure out how to manage the disagreements. Because as you know, not all compounds, products, drugs that come and get okayed by the FDA stay okay. They get pulled from the market when we see side effects that can be very deleterious to the patient's health.
Very true. So what happens in your office if you have a client that presents himself and says, "Hey, I'm a smoker"?
Well, that's what I've never had someone just confess it right out of the get-go, but
you ask them.
But I asked the question, right? And actually, some have said I smoke. But so here's how I think this is our approach at compassion, and that is that most clinicians would begin to just hammer them about the ills of smoking. And I don't know if anybody in the United States of America does not know that smoking is harmful to your health.
Right.
And so what I'll do is I'll just look at them and say, "Hey, I think that we would both agree that smoking is harmful to your health. If and when you're ready to stop smoking, I'm ready to help. I'll come alongside you. I will be on your team, and we will help you get this thing dealt with and managed." And that's just such a different approach. You can just see the patient just kind of go,
"Ah, thank goodness."
Yeah, exactly. And I never beat people up, not physically, but I'm just on their team.
Right.
And their health is really important to me, and it's important to them. And so we just, wherever they are, that's where we start. And then we go from there.
So we also have discussed a little bit about how your clinic is set up. And I think this is very interesting. Are you ready for a Shawn on that? Not yet. Okay. Give us the clue when it is. So I'll backtrack slightly. What happens when you have somebody that wants to do a lot of weight loss? Because we've talked about the GOP, the different things that are out there. And what's your approach to that? Because that seems to be a hot topic right now.
It is a really hot topic. I'll bet 15% of my visits each day are dealing with weight and weight loss. So here's our approach at Compassion. What I tell people is, however you lose the weight is what you need to do to keep the weight off. So I could put you on a cabbage soup diet, and in the next 3 months, you'd lose 30, 40, 50 pounds. But can you maintain the cabbage soup diet for the rest of your life? And the answer is no.
Right.
It's just impossible. And so I really stress the importance of two things: intermittent fasting and the Mediterranean style of eating and good healthy exercise, because those are actually things that have been studied. Now, I will use compounds to help people get some traction,
Sure.
to get some success, and then we wean off of those. So, for instance, whether it's high dose semaglutide, where you titrate up, or Mounjaro or Wegovy. Insurance companies really aren't necessarily covering that right now for weight loss, although obesity is a huge epidemic in our country, and I don't get why they're not, if they can be helpful. But there are potential side effects that maybe long-term we don't really know about that might come to fruition. But I've used phentermine and topiramate. I've used some other medications short-term to get some traction so we can get some success. And then we take those off, and then we're left with really what's most important: intermittent fasting, the Mediterranean style of eating, and good old-fashioned cardiovascular exercise with maybe some weightlifting to build muscle mass.
So they have to do the hard work.
Yes. Yeah. There is no easy fix to this. And it's a process. I mean, if it took, years to put on the weight, it's probably going to take years plus to take it off. But I always tell people slow and steady wins the race. And I always bring up Aesop's fable. Do you remember the tortoise and the hare?
Right.
And who doesn't, right?
Right.
And so I just say slow and steady wins the race. So if we lose a pound every week for a year, that's a great start.
That's wonderful. I'm glad to hear that.
Got those pictures ready.
Oh, wonderful. So please explain as we're going through with what we see as to how you designed your clinic, Greg.
So one of the big things is that we had an interior designer by the name of Heidi Cook. And when we were walking through the clinic before we did the remodel, she just asked, Greg, what do you want? What do you want it to feel like? And I just said, I want it to feel calm. And just, I want people to be relaxed as much as you can in a medical clinic, knowing that there could be some anxiety about that. I wanted to feel calm and soothing. And so she put together several different palettes of colors, and we don't have whites and grays. We have some whites and some grays and some pastels. And I've had numerous people tell me it's just so relaxing in this clinic. And it's like, that's the idea. The other thing is I don't have anything medical on the walls. I don't want that. Which kind of leads me to a side thought, and then we'll get back to that. But it's interesting to me how many people apologize for going on Dr. Google. And I will tell patients, it's okay. It's your health.
Right.
You go on Dr. Google, and then we'll talk about Dr. Google and whether Dr. Google is accurate or not for you. So anyway, when we think about the clinic, calm, relax, soothing, and then I thought about, well, we're going to have rooms, right? Well, room 1, room 2, room 3 is totally boring.
I agree.
So what we decided to do was we decided to theme the rooms. So this first picture that you're looking at is the movie poster room. And that's a Back to the Future with Michael J. Fox. And then you open up the door. Oh, there's my science room there. But you open up the door and you see posters of The Notebook. Because originally I just had guy movies up there. And a gal said, there's no check flicks on this thing. So we had to put the Notebook up. So we have The Notebook, and we have Top Gun and Casablanca back there, which is, I think, my favorite all-time romantic movie.
Nice.
So, yes.
Nice.
Next, Shawn, was the science room. Is that right? Yeah, there's the science room. And then you open up the door, and this is really kind of fun. Let's see. Can we get a picture of that?
There
it is.
Oh my goodness, I love it.
Cool. So that picture of Einstein came from a family that had been with me for years.
Nice.
And I was just talking to them about, we're going to theme the rooms out. And they said, well, our son just went off to college. We have this big picture of Einstein. Do you want it? And I said, I don't know. And they said, well, we'll bring it in. And it's like, I fell in love with that picture.
It is very, very
cool. On the back wall is go back, Shawn, if you would. On the back wall is the periodic table. And then on the left side, that's Madame Curie.
Oh.
The inventor of X-ray.
Wow.
So that's that. The next room this is probably my favorite room. This is the kid room.
Of course.
And one of the things, so you see a giraffe that's blowing a bubble gum, a bubble on the door. Mm-hmm. But this is the kid room. And it's amazing how many kids no longer fear going to the doctor's office, right?
Right.
Because here's what they see, this fun room. Mm-hmm. And I have toys in there that they play. One of the outcomes, though, that we never dreamed of was if mom or dad is sick and they have to bring the kids to the clinic and they're the patient, the kids play and they're totally absorbed in their play. And I can talk to mom or dad about their health.
Wow, what a concept.
It's great. It's been wonderful. Yeah.
That is cool.
So there's another picture. And then off to the right, you see that green thing? That's a little cubby that has this green kind of tree that comes down, and kids can go back in there and hide because there's a beanbag chair back there as well.
Oh, fun.
Yeah.
Very fun.
Okay, there's the giraffe blowing the bubble.
I love it. I love it.
Did we get through all those?
I think we're missing one room.
I mean, I do have another set to pull up. So go ahead and keep talking, and I'll figure those out.
Oh, yeah. He clicked on that. He hasn't brought it up yet. So
yeah. So anyway, it's just been fun, right? I mean, one of my ideas about medicine. Well, first of all, we have a why as to what we do, and we really truly understand what that why is. And it's not medicine. The why is actually the person, the patient,
right?
And creating a bond, a relationship, so that we can go to the hard places eventually. For their health.
The journey.
It is a journey. Life is a journey, and medicine is a journey. And so,
okay, how about these rooms?
Okay, so this is a fun room here. So, this used to be a lab, and we needed to expand and create another room. And so I asked the staff, "What do you think?" And everybody decided on the Wizard of Oz room.
Oh, fun!
And so we have the ruby red slippers on the door,
mm-hmm.
and then what you see there is Jess is my MA, one of my MAs. And these are basically, she is a Wizard of Oz fanatic. Mm. And so this is all of her stuff from her collection of the Wizard of Oz.
How sweet.
Yeah, it's pretty fun.
Nice.
Yeah, there's some more. Yeah, there it is. Yeah. Yeah. And patients love it. It's just different, right?
Right.
This is the ode to my addiction, which is golf. This is my granddaughter, Tia. She played a year of golf at LaSalle High School, and then you open up the door and there's a bunch of golf flags from different golf courses, either that I've played or that I want to play.
Very fun.
Yeah, it's a blast. Yeah, so
there's the flags.
Yeah, and there's the procedure room. Oh, and this is fun. So this is our superhero room. And what's really fun about this is not only do kids love it, but it's amazing how many adult men and women want to be in the superhero room.
Well, we watched those movies.
We did, didn't we? Yeah, we sure did. So you open up the door and you can see up against the wall there's all the superheroes. And then above the window there are some more superheroes. And then to the other side, I don't know if we got a picture of that, but there's a picture of some villains.
Oh, sure.
That the superheroes have to fight.
Yes, exactly.
And now this is our cityscape room. So there's New York.
Mm-hmm.
And then you open up the door and you can see San Francisco and Chicago and then Seattle as well. And it's just fun for patients, right?
Right. It just takes the edge off of being uncomfortable.
It does. Yeah, it really does. Yeah.
Love it. Love it.
How cool is that? Yeah, that design is really cool. They did a good job doing that. So we do have a question from a viewer. Mm-hmm. Why the tabs on the door to indicate your medical status? Why does that matter unless people are categorized?
So it's actually not about the patient. It's about me. And so, for instance, I have red. So red is my color. So if I see the red flag open, that means that's going to be my patient. And then we have different colors of black, white, yellow, blue. And so if black is where I go first, and then red, blue would be their next in line, red, white would be third in line, and so on and so forth.
Great question, Kathy, and great idea, Greg. So thank you for asking that, Kathy.
Sometimes visual cues for your provider is super important, right?
Where do I go? Where do I go? Well, this is where we go.
Keep Greg in the right place at the right time.
So, Greg, as we wind this podcast up, what do you have a passion for?
A couple of things, several things, actually. One of the things that my wife has taught me about, because I used to be a grinder, just my nose to the grindstone. And Teresa has taught me to enjoy the journey of life, which has been really fun. We've been married 42 years. And I think she'd say, Greg, 35 have been really good for me. So anyway, but that's just life sometimes.
Right.
So I love my family. I love my boys. I love our grandkids. I obviously love my wife. We've been together for 4 decades. Hard to believe.
Wow! Congratulations!
And it's been fun. I do enjoy golf, and then my passion for medicine is really what drives me professionally. We have 3 boys. 2 of them are dentists, and one of them, a couple of times, has said, "Dad, I wish I was more like you." And it's like, well, what do you mean, son? And he said, well, when you get up in the morning and go to clinic, you're excited. You want to do it. You want to be there. And as much as both my sons love and enjoy dentistry, I don't know that they're passionate about it. And medicine is my heartbeat when it comes to my profession. I'm 67. I'll turn 68 soon, and I plan on going for a really long time. I might cut down to 3 days a week, Tuesday, Wednesday, Thursday, and have 4-day weekends.
Sure.
But this really is my heartbeat, and I absolutely love medicine.
Good for you. Tell us how to get a hold of you. I'm streaming your website right now.
Great, perfect. We have a website, Compassion Family Medicine, and we're also on Facebook as well. And we are taking new patients, and my goal is I'm getting ready to hire another provider just so that we can expand and meet people where they're at, people that are looking for this approach to their medical health.
I love it, Greg. And just speaking of relationships, Jan and I have enjoyed get to know you over the last 4 or 5 years. And that's one of the things that we love about our job is just building relationships, not with just patients, but also other healthcare professionals. And I consider you a good friend. So thank you so much, Greg.
Yeah. Janet and Shawn, thank you so much. It's been a blast.
Fun.
And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Thursday to our midweek podcast, 8 a.m. to 9 a.m. Jason Gutman will be on our podcast, and he will be discussing how it's not expensive to eat healthy. Thank you for tuning in to Health Solutions with Shawn and Janet Needham. Thank you.